So another very important thing also is to know personally that you are emotionally and physically invested, committed to the HSCT treatment as something that will and can change your life. But you also have to remember that that commitment includes taking all necessary precautions, especially during the isolation and the recovery phase, which is quite long. For example, in my opinion, the most important things concerning the possible precautions required are the nutrition, the safe nutrition and foods that you are supposed to be consuming during that isolation and immunocompromised time, and also the environment that you are surrounded by, which also includes the extreme hygiene you need to be taking care of, like washing hands and just making sure that your environment is extremely clean. But yes, I must say that I am pretty darn scared of the treatment. If I must admit, I am fully committed to the treatment, but yet of course I am allowed to be scared and afraid, but maybe more the things that make me scared are maybe more of the recovery and the isolation phase rather than the treatment in itself, like the chemo and the stem cells and putting the PICC line and all things that are involved in the HSCT treatment. But yes, I will try my best taking all the necessary precautions, and in that way, I am able to minimize all the possible risk of contracting a opportunist infection. And that is from that because I had in the past about 1 year and 1.5 years ago, I had the first dose of Lantrata. I was in the hospital for 3 days, and after I was discharged from the hospital, I spent the weekend at home and tried to keep my environment clean and tried to wash my hands enough and use hand sanitizers and all that thing, just to make sure that I wasn't creating any dangers for my state of during me being immunocompromised. But yet I had contracted something. I don't know where the bug came from, but I eventually after the weekend, after the 2 days I spent, I was stable at home. On Monday I had to return to the hospital because I developed a high fever quite rapidly in a short period of time, and I spent one night in isolation receiving IV antibiotics, but the doctors weren't quite sure what was the actual cause for this infection I was having. But anyways, it was something considered something severe, like a severe infection. So that really scared me, and I was crying, and I thought that I was having sepsis because Lantrata did lower my immune cells. My lymphocytes were close to zero, and the only symptom basically I had the fever, and I was almost sure that I was having a sepsis. So that is something that really keeps spinning in my mind, and I just can't not think of it because I can't help it, but I constantly think of it because in HSCT, the chemo, it is strong, and it will definitely kill your immune cells, and you're left with basically no immune system. So there is this danger of developing a sepsis. So I already had a severe infection. I don't want to get a sepsis, so the only way is to be extremely cautious with any kind of activities post HSCT, and just make sure that everybody around you is aware about your situation and also takes care of their own hygiene, especially around you. Of course, naturally, it can be a scary thought, especially to a patient that has been recently diagnosed and is on some kind of conservative treatment, like in some of those injectable treatments or oral treatments, which are thought to be milder treatments. Of course, I consider them not as very effective treatments for MS, but those treatments can kill a person. At least I've heard about deaths caused by oral and some of the IV treatments for MS. So from that perspective, it is very scary thing to undergo HSCT. But if you think of the HSCT process, HSCT is not a single drug. HSCT is a treatment where you are taken care of at least for 30 days, depending on treating facility. You are being treated for days. You are treated with chemotherapy. You are treated with your own stem cells. That is not a single pharmaceutical agent that you are given. You are given a mix of chemo agents and other drugs in order to bring out the best effect and make the best effect possible, as an aim to seize and halt the complete disease progression. From that perspective as well, any conservative treatment cannot be even compared to HSCT treatment. And if you other aggressive treatment, especially used for cancer patients, for example. And if we compare the autologous hematopoietic stem cell transplant to the allogenic stem cell transplant, the mortality risk is about less than 10% of the corresponding allogenic transplant. HSCT, but in a nutshell, HSCT is very effective treatment for MS patients. But let's all keep in mind that MS and HSCT can be fatal if we are not careful and not effective by treating MS in the right time. And facilities performing HSCT for autoimmune disorders, they must have the right fame and the right knowledge and experience in performing HSCT. So if I was you, I would just make the possible research and learn about other patients' experiences before opting and making the decision for choosing the right treating facility, if you are able to choose. But I have all the faith in the facility in Moscow, and I have faith in them, and I will give my life to their hands, and I just hope for the best result. And I am not afraid, but of course I will be taking all the precautions, especially after the discharge from the hospital and during the recovery phase. But there is much we can do to reduce the mortality rate even further. So just keep in mind these things and you will be just fine. So yes, I think this death theme was quite a long story, but it is an essential part of reality in life. But let's hope that there won't be any deaths from HSCT in the future, but that of course can't be guaranteed. But with your own actions, you can at least lower your own mortality risk related to the treatment. But that was it for today. Thank you for watching. I hope that this was somewhat educational or informative or something that will make you gain something from these two videos. And hopefully I see you soon watching my next videos. Hit the like button if you like my video or both these videos, and I hope to see a new donation since my treatment date is slowly approaching. But thank you anyways for watching and supporting me, and see you soon. Bye bye.